Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Mohammed AlSheef, your host for Elixir of Life, live from Saudi TV Channel 2, kicking off another inspiring and informative episode with our distinguished guest, where we aim to explore new frontiers and bring you the latest information related to healthcare. Our program is filled with many inventive and attractive segments, but the most important and the topic of the week is research and the importance of research in Saudi Arabia. Without further ado, we'll go for a break. Stay with us. Welcome back to Elixir of Life. Our next segment will be Quote of the Week. Stay with us, don't go away. Welcome back to Elixir of Life. Our next segment will be medical news, and we will start by the first medical news, World AIDS Day conference. Let's see more details in this report. Stay with us.
My name is Dr.sheef Mustafa Rashid. I work for the National AIDS Control Program as surveillance officer. Today we are celebrating the World AIDS Day. You know that globally, all the world celebrate the World AIDS Day at the 1st of December. And each year, we at the National AIDS Control Program in Saudi Arabia, we celebrate this event. Today our event is titled, or the mandate of our celebration is to stop stigma and discrimination towards people living with HIV and AIDS and their relatives. You know, all those infected with HIV in Saudi Arabia or globally, they face a lot of stigma at different settings, at the community, at the family level, and most importantly at the healthcare setting. So the focus this year is how to minimize and hopefully to stop all kind of stigma, all kind of discrimination towards those living with HIV when they are seeking care at all healthcare settings, being private, being public, or being governmental hospitals. So the focus, we hope that all the media, all the people working here in the National AIDS Program, in different ministries, will also take the lead in disseminating this messaging through to the whole community, raising the awareness of the whole public about this issue. Because if we do so, all the public coming aware, all the healthcare providers coming aware and not discriminating others, this is going to have very big positive impact on the HIV epidemic in the kingdom and elsewhere.
There's a percentage of people who actually ignore the disease. What do you advise for them?
Ignorance will not help them at all. Yani if you have any behavior that risks you of having HIV, please come forward, come for testing. You have to know your HIV status, because knowing your HIV status, this is going to help you, it's going to help your family, it's going to help the community as large. So please don't get afraid. The services are free, are 100% confidential. Nobody is going to know their HIV status except very few people, and they're going to give you all the help you need.
Once again, welcome back to Elixir of Life. Our next segment of medical news will be a report about Saudi Hypertension Conference. Let's see more details in this report. Please stay with us, don't go away.
I'm Dr. Hussam Jnaid. I am consultant internal medicine and section head of polyclinic at King Faisal Specialist Hospital, and I am the co-chairman of the organizing committee of the 5th Saudi Hypertension Conference. This conference is the 5th Saudi Hypertension Conference, and it is the second conference which is held in King Faisal Specialist Hospital in collaboration with the Saudi Management Hypertension Society, or Shams Society, regarding this disease. Actually, hypertension is the silent killer, and 1 out of 4 adults have the disease. Some of them they know, some of them they don't know. And if we detect it early, and if we prevent it and work on it early, then we can save a lot of lives. And this is the logo, and this is the slogan of the conference, which is "Early detection saves lives."
My name is Dr. Rasha Bazari, and I'm an adult cardiology consultant at the Heart Center in King Faisal Specialized Hospital and Research Center in Riyadh. High blood pressure or hypertension is considered a silent killer because most of the time patients do not have any major symptoms, and by the time they have symptoms, it's usually late, and they will have developed some complications. It is a silent killer. It causes a lot of illness and disease. It causes society loss of function when it affects young individuals as well as older individuals, with different complications affecting the heart in the form of heart attacks, affecting the brain in the form of strokes, and of course other major complications like renal failure, loss of vision, affecting the nerves with decreased sensations, and all the complications that really come just from undertreating or untreating hypertension.
Yeah, I'm Dr. Wissam Kurdi. I'm a maternal fetal medicine subspecialist, and I work at King Faisal Specialist Hospital in Riyadh, and we are hosting the 5th Saudi Hypertension Management meeting. Hypertension is a very, very important health problem, and it affects maybe something like 20–25% of the adult population, and even in children we can see hypertension. So it's a very, very important health issue, and that's why, as usual, King Faisal always tries to focus on important topics that have a big implication for the general health of the population.
Doctor, let me ask you, I see now young people now get high blood pressure. What do you think is the main cause of this?
I think one of the very important topics that was just presented this morning is on the epidemiology of high blood pressure. And obviously one of the very, very important contribution to high blood pressure is obesity. And obesity is a serious problem in the population. And obesity, unfortunately, is even starting in the younger generation. So that's why we are seeing more and more younger generation with high blood pressure.
Fantastic. Doctor, any last thing you'd like to mention?
I'm obviously a maternal fetal medicine subspecialist. I deal with pregnant women, and hypertension is very, very important also in the pregnant population. Maybe like 10% of the pregnant population will have high blood pressure, and it's very, very important for these people who already know that they have high blood pressure to go and see their physicians even before they get pregnant, because there are some medications that you cannot use when you are pregnant. So this is a very important message to go out to the public. And the control of the blood pressure during the pregnancy should be under the supervision of your obstetrician and your internal medicine physician. So I urge all pregnant mothers to actually be under very good control of their blood pressure under the supervision of their managing physicians.
Once again, welcome back to Elixir of Life. We are coming to the most important segment of our program, which is our episode theme, is importance of research in Saudi Arabia. And it's my pleasure and honor to welcome Dr. Ahmad AlBader. He's consultant urogynecologist and Executive Director of Research Center at King Fahd Medical City, and Ms. Hala, AlJishi Research Specialist. Welcome to our program.
Thank you for having us.
Okay, then. We have so many important questions. We will start without further delay. First of all, we hear that you have last week annual King Fahd Medical City Research Conference 2016. Could you tell us more about this program or about this conference?
Sure. The annual conference is an event whereby researchers in King Fahd Medical City gather and display their research, share with other researchers, and then compete for prizes. Researchers mainly from King Fahd Medical City and from outside our walls apply and through a scientific committee, group of research projects are grouped into either oral presentations or poster presentations. This is our 11th event. It means that it has been there for 11 years. Which is something King Fahd Medical City is proud of. This is the first time as the research center became an executive directorate. There has been two main categories, which is oral presentations and poster presentations, and in between those there were a couple of keynote lectures of distinguished speakers talking about different aspects of research. Overall, there has been 17 oral presentations and 120 poster presentation chosen from more than 250 submitted proposals.
Very impressive. 120 posters and 17 oral presentations. Yes. That's very impressive. We will go for a very classical question. What are the objectives of this conference?
Main objective is to enhance research capacity, encourage researchers, support the research culture, get research to communicate. So overall, enhance research capacity and support researchers overall.
And also, I think it's important opportunity to network between the junior and senior researchers.
Absolutely, absolutely. This is a very important part. Here in King Fahd Medical City, people usually do their research in their own departments. When in this annual symposium, people get to meet, they get to interact. There's an opportunity to go beyond their walls and interact with other researchers. So it's an opportunity to get their research more horizontal expansion to other areas. Yeah.
Excellent. Ms. Hala, what's the target audience of this conference?
The conference was open to everyone, to all medical public. So all KFMC staff were encouraged to participate in this conference and submit their posters. And not only that, but also the students, the residents, and the fellows at KFMC who work with consultants at KFMC were encouraged to submit and just be proud of their research work.
So all healthcare professionals, not only physicians?
Not only physicians, all KFMC staff, whether allied health medical providers or physicians or even administratives.
Do you have any percentage of junior staff, like student and interns or medical trainees?
We have about we have about like 20 of the submitted 20% of the submitted projects of students, and we have actually one of the residents won one of the prizes from the Women Hospital. Yeah, so we have a good number.
Excellent. I think this is important to motivate and stimulate the trainees to participate. We'll go to Dr. AlBader. What are the categories of research awards?
Again, they're broken down into posters. Posters, there were 7 categories in poster presentations, and in oral presentations they were broken down to 3 categories: consultant physicians, non-consultant physician, and then allied health group. Consultant physician, there were 3 prizes. For non-consultant, there were 5, and then allied health, there were 5 prizes.
which is one more important, the oral or poster presentation?
The oral presentation is usually considered more important, and the scientific committee usually, when they evaluate abstracts, submitted abstracts, they usually choose the more valuable, the more scientific, the more beneficial to be submitted, to be presented as oral presentations. We try as much as we can to accept most of the most submitted abstracts, trying not to reject anybody if we can. However, there are ones that do not fulfill the criteria for such activity, and or withdrawals.
And unless there is major defect, otherwise you are generous. You don't reject, to encourage participation and open the path for outside participation. Am I right?
Absolutely. We also had a session where we gathered people who we thought they needed assistance, and we helped them with developing their or making their posters even look in a better way. One of the purposes of this event is to try to educate young researchers on submitting their work to international conferences or to conferences generally, and to show them the way on how submission is, how abstracts are presented, how they are rated, how posters are, and so on. So part of it is the experience itself, and educating our healthcare workers on our junior healthcare workers on how to interact in conferences. As you mentioned, for juniors, it's quite important for juniors. As Ms. Hala said, good number of submission this year is juniors, where compared to last year, this ratio is getting higher, and that's what we really try to emphasize and try to encourage, that more juniors rather than seniors submit and be there. Yeah.
I think it's important to get feedback from their submitted research project, because they will get feedback from the jury. If they participate another time, I think they will add, they will improve.
Absolutely. Yeah,
we are coming to a very important question. What's the history of research center at King Fahd Medical City? What are the important milestones you have?
The research center at King Fahd Medical City it's the first research center of Ministry of Health Institute. It was established in 2007. Where it was a research office under the Academic Affairs Executive Administration, with the main aim of supporting research. With time, this grew, and in the end of 2015, an approval was to become an independent body as an executive administration, reporting directly to the CEO of King Fahd Medical City. So if it was looked at from perspective of number of publications, research activity, we continue to grow year after year, and now it is quite recognized, one of the centers in Riyadh that is producing research.
Excellent. Now we'll come to Ms. Hala to tell us more about the educational research activities throughout the year provided for the trainees.
So we have a lot of educational activities. We have internal and external. When it comes to internal, the research center makes sure that we separate the research culture among KFMC staff. So we have the educational activity calendar. Basically, it is at least one activity per month throughout the year. So we'll have at least 12 activities going throughout the year. KFMC staff will be can register, and will have CME hours for them. It's presented by very expert consultant in the field. They are also trained to the good clinical practice. We make sure that whoever is interested to be involved in clinical trials to have this certification. So that's once. The other thing is internally is being done the outreach activities where we tailor the needs of each department of the hospital, of the medical city, and we go ourselves and present the lectures based on their needs. So that's internally. We also have some external collaboration with universities. Like recently we had the START program, which is the summer research program, in collaboration with Princess Noura. And we've been training about 50 female students, medical students, on research. We also care about the awareness and show in public. So we've been participating in Prince Sultan University in their research day, starting from 3 years ago until this year.
That's very impressive. It's a lot, okay? Next question, okay, to you, Ms. Hala. What's your role as a research specialist or research assistant or coordinator?
So the research specialists and the research center at King Fahd Medical City, they work to coordinate first clinical trials. We have a lot of clinical trials in so many fields, starting from oncology, internal medicine, thrombosis, and etc. So we do the coordination for the clinical trials. When it comes to PI-initiated studies, which is physician or any KFMC staff-initiated study, we basically hold their hand and walk to them throughout the research journey, starting from coming up with an idea, to formulating a research question, to the other research stages. We can talk about them more.
Sure.
We also provide them with consultations. We refer them to the expert in our research center, and we provide consultation when it comes to methodology, when it comes to statistics. We have a good team of biostatisticians who do a very good job. So basically, that's what we do. We play the we try to defend and develop the research skills for those staff.
Thank you, Ms. Hala. I think this is an important question. Did you observe any difference in the research productivity after increasing the number of research specialists, or did it make difference in the ground?
Actually, it did. A couple of years ago, we created this, or we proposed this study of introducing coordinators and see how that changes the activity, research activity generally in King Fahd Medical City. And whereby we introduced around 11 coordinators in different hospital areas. And during a period of around 18 months, we looked at research activities. And there was significant increase in number of research completion, projects that were slow, projects that were unable to continue. They were finished in quite significantly short time. Publications increased significantly, and this research project actually has been submitted for publication, so it's in the stage of publication now. And overall, it shows that introducing coordinators, having them available for researchers, increases research activity and make research more feasible and easy to conduct.
And do you have a plan to increase them more? Because you mentioned significant impact, because we are looking for more. Okay.
Absolutely, you're right. We need more. There are many challenges for that. First, the title of coordinator is not established in the government sector. That's one of the issues. Number two, there are no good training programs for coordinators. Currently, King Fahd Medical City in the final process of getting an approved program from the Saudi Commission for Health Services, which is like a one academic year for training for coordinators. The other issue is that there is no specific salary scale for researchers in general, and one of which is coordinators. And that makes it less attractive to research coordinators. And that's what we're trying to work on. This is one of the challenges that we're trying to overcome by trying to get a salary scale for coordinators. So we're going in different directions, trying to establish that and make it more feasible.
Yeah, being a physician, because as a physician we are overwhelmed with clinical duties. We are very busy. We are not basically researchers, we are clinicians primarily. I think we need assistance, okay, research specialists. Talking about myself and on behalf of my colleagues, it made big difference. I think this is important, so I'm willing to increase the number to serve more research or to promote research at King Fahd Medical City. We will go for another question. We'll navigate another important question. What services that provided by research center to healthcare professionals?
Okay, that's actually a very good question, and it links us to the previous question. The research center at King Fahd Medical City provides researchers with fund if they apply to it, and if they get scientifically, if they pass the scientific review, then they get funds. Depends on what is the data collection or methodology of the research project, if it's retrospective or prospective. And having that said, the researcher will be able to hire the enough staff and pay them to work for that period of that the research is going on, and by that can overcome the challenge that we have of shortage of coordinators for data collection. So that's one of the services that the research center provides. We do also provide the coordination of clinical trials. As of 2008, we had more than 33 sponsored clinical trial, and now more and more by 2016. We've already discussed the educational activities that we provide. We started the help desk line almost a year ago. We've been having a lot of receiving a lot of questions from all over, and I think it was a very good idea proposed by Dr. AlBader to be just out there, reachy to any KFMC staff. If they have any question, they just can call and get help instead of just making an appointment and coming to a meeting, you know. We also, there's something very important that we should mention here. We provide incentives. So any researcher who publish in very high index journal with a high impact factor will have incentives for doing that. And all of that we do to enhance, as Dr. AlBader said, the research culture among KFMC and increase the research productivity in KFMC.
Very wonderful. Dr. AlBader, what's the importance of research at King Fahd Medical City in particular and in Saudi Arabia in general?
As you know, health research is quite important in developing healthcare, in improving delivery of healthcare, in discovering treatment modalities, investigations, and so on. So it is one of the cornerstones in improving healthcare. King Fahd Medical City identified the importance of research and made research one of the 4 strategic objectives for the 5 years from 2015 to 2020, where research excellence became one of the 4 important strategic objectives that we try to emphasize and try to expand, enhancing research capacity in general. Many different initiatives have been started. Again, the research center became an executive administration. Researchers have been given more time to do research. A new policy came out that helps clinicians to get time off specific for research. So according to their research activity, they could apply to their chairman of departments, and they could be given specific amount of time for research. Currently, the maximum time is about 10% of their work, which is considered not too much. However, I think this is a start for an institution that has not been originally been established as a research center, and we're hoping that we can increase this allocated time soon. Of course, research funding is being supported even more. The research lab is given priority, and labs are being prepared as top-notch research facility. So in general, I mean, research has been given a priority at King Fahd Medical City, which we're happy really to see.
So, so it is necessity is not luxury. Research is a necessity, is not luxury for us.
Some countries spend up to 10% of their budget on research. Some of the big countries. So spending money on research is one of the ways that we should look at, because there's no way you could tell what are the important diseases we have, what it's killing us, what do we need to do, which direction we need to go without research. So it is really important, as with in all directions, not only in healthcare, but in healthcare it becomes even more important.
Thank you, Dr. AlBader. Now we'll go for a brief report about annual King Fahd Medical City Research Day. Let's see more details in this report. Stay with us, don't go away.
With me here is Dr. Mohammed from the King Fahd Medical City, chairperson of Clinical and Applied Research Department. Good afternoon, Dr. Mohammed.
Good afternoon.
Dr. Mohammed, could you tell us a little bit about this great event that we're attending today? Could you give us some info about this contest in general?
Actually, this is the 11th KFMC Annual Research Symposium. We started conducting this event since 2006. And what is really impressing and really promising about the research at KFMC, that the growth of the number of abstracts submitted each year is on growing scale.
Indeed. Dr. Mohammed, could you tell us a little bit about the types of research that are participating, the types of research that are in this contest?
In order to really comply with the vision of Research Center, we would like to spread the research culture. So all kinds of research were accepted based on specific criteria, as all same as all other international conferences. And the Research Scientific Committee, 2 members of the Research Scientific Committee reviewed the abstract, and we received this year 180 abstracts, of which 155 were accepted.
Could you tell us a little bit about the researchers themselves, the participants in this contest? Where are they from? Are they from the Medical City, King Fahd Medical City, or from other branches?
90% of the participants were KFMC staff, but 10% were from Princess Noura University, other universities in the kingdom, and we got also some participants from the Gulf area.
With me here is Yara Bashauri, biostatistics specialist, and also one of the winners of this contest. Good afternoon, Ms. Yara.
Hi, good afternoon.
Could you tell us a little bit about the research that you've won, and how do you see the research, and if you can give us a brief info about the research?
Yeah, sure. So we looked into diabetic patients with chronic kidney disease, and we tried to identify a sensitive new biomarker. And the reason for that is because the biomarker that's been used at the moment in clinical practice, creatinine, it's not very effective. It's affected by other factors that they're not related to kidney disease, such as age, mass muscle, and other things. And a previous study found that cystatin C, it's a better biomarker. So this study basically looked into different variants, structural variants of cystatin C. And there was significant evidence that cystatin C could potentially work as a biomarker for diabetic patients with kidney disease.
All these researchers, all these posters coming together in the King Fahd Medical City. How do you see the significant importance of this event?
The research center worked so hard to put this event together. I mean, there were more than 100 posters. It's a great opportunity for researchers and upcoming researchers to share their knowledge and learn from previous researchers as well. There were a number of oral presentations that were outstanding. Like I said, it's a great opportunity to share the knowledge and spread the culture of research.
Once again, welcome back to Elixir of Life. I would like to welcome again Dr. Ahmad AlBader and Ms. Hala AlJishi, and our episode theme, Importance of Research at Saudi Arabia. We'll go deeper and deeper, and to tell us, Ms. Hala, about the stages of research. Is it a systematic process or just haphazard?
No, it is a systematic process. So we have 9 stages of research process, starting with coming up with an idea, and then we formulate a research question. We need to know if the research question is feasible or not, is it doable or not, can it be done in our facility or not, do we have enough power, and etc. So, and then we go search the literature review, what has been done before, what can we develop and in addition to what been discovered. Then we move to the study proposal. So we build the study proposal, which is the infrastructure of the research, which is the plan, the roadmap of our research. Then we submit it to the ethics committee. After we get the approval, which is the green light, we can proceed with data collection. After that, we do the data analysis to writing the manuscript, and then the publication. We also emphasize that research without publication is not research. If you don't publish, nobody knows about your work.
It will be kept in the drawer.
Okay. Yeah. So it is research takes time. So we also encourage our researchers to be patient and take the time through all the process and end up with a publication.
So it's a long journey.
It is. It takes up to, depends. Some research projects takes up to 1 year, 2 years even. Yeah.
What's the most difficult stage among the 9 stages you have mentioned?
Well, pretty much the data collection, because it's the mid stage. It's the neck of the battle. So if you proceed and pass it, then you will be able to end up with a publication. Writing the manuscript takes a lot of time too, because KFMC, which King Fahd Medical City, is a hospital. Most of the staff are not researchers, not primary researchers.
Sure.
So they will need time. That's why we created these incentives that, just like Dr. AlBader mentioned, the protected time and the publication incentives, and we also reimburse for publication charges. So all of that helps our researchers to end up with a publication.
Dr. AlBader, do you agree or you think is publication is the most difficult stage because it's the finish line. So can you just to hear your perspective in this regard?
I agree with Hala that data collection is one of the most difficult. It is not the bottleneck. Some research data collection could take a couple of years. I mean, I know there are some research projects that take 2, 3, 5 years to do data collection. That takes majority of the funds that is needed and time and labor intensive. Publications take some time, and research needs to be written in a good way that can be acceptable in a good ranked journal or a high index journal. Now, going to a good journal needs to be you have your study written in a good way, looked at and analyzed in a good statistical method, and then submission sometimes takes somewhere from several weeks to a couple of months. Which is quite long, but most of the time it's much shorter than data collection. Those two stages probably are the most difficult stages of research.
Again, another important question that came to my mind: what's the importance of research ethics committee?
This is an important question. The Research Ethics Committee ensures that research is done within guidelines and protects the subjects being investigated. Protects the subjects, meaning the patients or the public, and protects the place, the hospital, the environment. So there are guidelines and procedures that researchers should follow and should not deviate from. Part of it, for instance, if you're involving patients, you need to give the consent them by informing them about what the research project is about, how is it going to be beneficial, and it's going to be anonymous, their names are not going to be used, that their involvement is voluntary, that they could decide to say no, and they're still going to be treated. They're not going to be denied health care. So there are standards that needs to be followed, and this is what the Research Ethical Committee makes sure that any research proposal passes through the committee before going any further step. Usually the research committee is independent of the research center, and usually a committee is represented by the public, by different areas in the hospital, and by different scientific backgrounds.
I think related to this question, the importance of informed consent. So you mentioned this is voluntary, right. So the patient has the right to agree or disagree to participate.
True. You're absolutely right. The patient has the right to agree to participate, and they're anonymous, and if they decide not to or they decide to withdraw anytime during the research project, they have the right to, and they should not be denied treatment at any stage. And this is very important of any research ethical approval.
Excellent. And we have, I think, in our society misconceptions about research, because if you discuss with patient research projects, sometimes they mention we are not lab animals, okay, to experiment on us. Do you think this is important barrier? How to overcome this? Okay.
It is a barrier indeed, and you're absolutely right. We do hear that a lot. However, is there a way to develop medications or treatment without doing research?
No.
There's no way. A lot of centers in North America and the US, for instance, when they first invent chemotherapy for treatment of cancer, they involve patients in large trials. And then when the trials show, because of preliminary data showing that this is effective, and then when they involve patients in large trials, at the end they say, okay, when they analyze data, they say, okay, this is an approved treatment, and then it becomes a treatment that is available to everybody, or they say, well, effectiveness is not that much, and they decide, okay, let's look at something else. There's no other way to find medications or treatments or advanced healthcare other than research. It's not really treating them as animals, but this is the way to advance research. There are treatments that we know, however, there are things that we don't know, and we're not going to be able to advance the treatments that we have today unless we do research. So if patients are not going to be involved, who's going to be? I mean, even us physicians, when we're sick, we are patients. So when I come to you and you suggest that you want to enroll me in one of your studies, I think it's an opportunity for me to improve healthcare by getting into your trial, and as well I might be treated with something that is not available today, that I might be offered the treatment that might help me.
I think it's important. This is shedding light on the importance of informed consent, informing the patient about the benefit, about the risk, and alternatives. Okay, I think that's important point. We are going to important question. This is regarding our country, Saudi Arabia. What's the rank of Saudi Arabia regarding research productivity compared to other countries? What's our location in the research map?
This might be a bit difficult to answer scientifically. I mean, I'm not aware of a scientific, there could be, but I don't have that data in front of me now. However, there are different ways to measure research productivity. Number of trials, number of publications, index versus non-index publications, amount of funds used for research, and there are different measures to measure amount of research. Saudi is considered one of the big six, I think, biggest countries in Middle East and North African countries who in conducting research, in being involved in pharmaceutical or industrial trials. So we're considered one of the bigger ones. However, we are really not investing much in research. We are not, unfortunately. I consider ourselves in our research infancy. We're still a long way to go. Although we've got brilliant researchers, we've got very good research going on in Saudi. However, the infrastructure is still to be built. Really, we need a lot of encouragement. We need a lot of expenditure. So generally speaking, I mean, we're okay compared to other neighboring countries, but we're no way near to okay compared to more advanced, developed world. So we still have a lot to do.
So regionally, we are top 6 countries. But compared to North America and Europe, we are still lagging behind.
We are behind, yes.
And I think this leading us to intensify efforts. And
absolutely, completely agree. Yes.
Now you mentioned the stages of publication, stages of research, and the most important you mentioned, and the last step is publication. If I would like to publish a research, what are the criteria I should look for? Because we oftentimes hear about indexation. Is it index journal, non-indexed? Is it peer-reviewed journal or not? Is it high impact factor, low? Just to simplify these, terminology for public.
Sure. I think this is important, as mentioned by you, mentioned by Hala, that publication is the most important to tell the world that this is the study and this is what we found. So publication is really important in what we call peer review journal. Peer review journal means that the publication is reviewed by scientists who are knowledgeable in the field. It means that I just don't come up and put something in a journal and say this is science. It has to be reviewed. There has to be some remarks making sure that it fulfills some standards and questions have been answered. Now, there are journals that are considered high impact and what we call index journals. And index means that this journal is registered and has an impact factor. Impact factor means it has a sort of registered with a body, which is called ISI indexing, and with that indexing, with the impact factor, that number tells you how many times that journal has been cited in the past year. So the impact factor changes every year. So really going to a higher impact journal, it means impact factor. It means that your journal would be more likely to be exposed and will be cited, more likely to be cited. So we usually encourage researchers to really go to index versus non-index. So index is really wanted, and higher the impact factor, the more prestigious and the more likely your article would be looked at.
I think now we are coming to the end of our interview. It was a great pleasure, Dr. Ahmad AlBader, consultant urogynecologist and executive director of Research Center at King Fahd Medical City, and Miss Hala AlJishi. She's a research specialist at King Fahd Medical City. It was really informative, inspiring, and enlightening session. Thank you very much.
Thank you for having us.
Okay. Now we'll go for the next segment. Will be health myth or fact. Coffee cause cancer, myth or fact? Let's see more details in this report. Please stay with us, don't go away. Once again, welcome back to Elixir of Life. Our next segment will be health benefit of tomato. Let's see more details in this report. Stay with us. Once again, welcome back to Elixir of Life. We discussed extensively research. I think Research is the systematic investigation and study of human subjects or lab animals to reach new facts and conclusions. Research has led to the discovery of new medical treatment and cures that have helped to treat several diseases, thus increasing and improving quality of life. With this, we are coming to the end. We wish you have enjoyed watching our episode and found it useful. Would like to thank our distinguished team, starting and led by Mr. Abdullah Al-Wulai'i, cameraman Salim Al-Uraibi, Awda Al-Utaybi, lighting Fawaz Al-Rusayis, Fahad Al-Yahyan, Diku Khalid Walid, sound Mohammed Al-Jutayli, prepared by Rihab Al-Khulaitit and presented by me, Dr. Mohammed AlSheef. Until next episode, we wish you a pleasant week ahead. Assalamu alaikum. Goodbye.